So before we discovered Practice Unbound, we were facing challenges similar to a lot of practices with increasing amount of workload, both in terms of clinical pressures, but also administrative and documentation, with increasing amount of patient letters coming through and having to spend more and more time on non-clinical roles within the practice.
Before using workflow, the scanners had to manually input all the letters to the GPs. That would have meant screening letters that were completely normal. It would have meant letters that were telling us that the patient had not attended a clinic. And these were letters that didn't require to go to the GP, but were going to the GP.
We had looked at various ways of trying to reduce this by designing a system ourselves within the practice, but we're constantly being restrained by time to make that process work, and also making sure it was a safe process that would work for all. So when we started looking at the workflow optimization program, one of the key features we were looking for was the safety and the clinical governance behind it. We were very impressed with the structure of the program, the way that it supported and implemented the training, both for the clinical GP lead and for the wider administrative team. I also like the fact that all of the work that is done is underpinned by regular reporting and auditing to ensure that safe standards are being met. And the Practice Unbound team were very good at supporting that work within the practice, helping us understand how to use it and how to make sure that the processes were being done safely. The main benefits that we've seen as GPs since implementing is a reduction in the volume of documents that we're having to deal with on a daily basis. Since we've introduced the workflow optimization, we have managed to increase our patient appointment length from a standard 10-minute appointment up to 12-minute appointments. We've also been able to release this time into modernising the practice in other ways, such as a digital online triage system. And without the time released by the workflow optimization program, we would have struggled to do this.
When we found out that the GPs were going to implement the workflow training, I volunteered straight away. I really felt it was something that I could do well. We were anxious. In some of the letters, we're the first people and the only people that read those letters. But with the help from the GPs, especially Dr. McLaughlin, and with the auditing process, that really gave us the confidence that we needed to carry out this workflow.
I think when we were first told that workflow was going to be implemented, it was quite nerve-wracking in terms of the risk associated with completing letters and actioning letters that the GPs would then never see. But it was exciting as well to be given the opportunity and the responsibility of doing that work, and especially considering the expansion of skills that would come along with that.
We found the e-learning process really straightforward. It was great. You could do it any time that suited you, whether that be in a 5 minutes at work or whether that be at home on the tablet. By being able to log into the dashboard, we could see how the staff were progressing through the modules. They took it at their own pace, and we could see when they were ready to start with the workflow process.
The online training program is really well prepared and very easy to access. What we liked about it is it did not assume that people already had a basic level of knowledge of how to safely deal with documents that were coming into the practice.
In the training, they focused on specific letter types. We looked at, there was a psychiatry one, for example. So it goes through the basic parts of the letter that you would need to check. Date of birth, the address, standard of what you would do with any letter that would come in, and then it went on to specifics that you would actually find in that letter, the important information that you would need to pull out and give to a GP in terms of medication changes, any diagnosis that had been given. So it was quite good, and it gave a comprehensive list of everything that we had to be looking for when we were going to be doing this on our own.
The programme also has an online module for more advanced letter types, which helps, once the program's been initially established, again build additional confidence when the complexity of the letter starts to increase. And I found that was a really useful module to sit down and do all together. So we sat as a group and worked through that module, all 6 of us, And that was really useful because it showed how letters that come from the hospital can be ambiguous at times. They can have conflicting information, and it helped us discuss in detail how the team would deal with that. And that's proven really successful when they've taken on the more challenging letter types.
At the moment, we process any DNA letters, A&E letters, screening, so that could be bowel breast screening. We do cardiology letters, ENT, psychiatry, haematology, orthopaedic, physiotherapy. I think at the moment that's about it. We're just about to introduce general surgery letters as well.
The workflow team are getting on really well. They have a sense of achievement. They're progressing at their own pace, increasing the letter types as we go along. It's certainly also increased their confidence levels.
So the ultimate goal is to reduce the GP workload, and it does give us a good feeling that we can help with that. I think it improves their experience, and they can give more time to maybe the patients themselves that come in for consultations if we can help with their workload.
Since implementing workflow optimization by Practice Unbound, the system is much more streamlined, and I would highly recommend it to anyone.